Guys, I'm Dr. Ismaili. Just want to quickly review how we take the CBCT for purposes of the airway assessment. The most important thing is the repositioning the patient in a way that does not interfere with the airway or positioning of the joint into temporomandible joint. So I'm going to have Gabe just scooch a little bit over here. If you can remember, bringing the machine to the patient, not patient to the machine. And also, we do not want to put any object or any of the positioning sticks between the patient's teeth. So as I'm watching here, I'm going to instruct Gabe to close your eyes for me for 10 seconds and have him just I'm not going to tell him where to put his tongue, nor am I going to tell him how to position his head. I'm just asking him to close your mouth, close your eyes, and breathe for 10 seconds. His brain automatically will position his posture to where he can breathe, and that will give me a good glimpse of his breathing mechanism. Now that I know where it is, I'm going to move the machine to a place where it would be closer to where I can support his chin without him having to tilt his head forward. So go ahead and scooch a little bit for me. See if you can grab onto these two handles. Beautiful. Perfect. Come a little closer. You want to make sure that the machine is not hitting the patient anywhere. Perfect. Now come just a little closer and very gently go ahead and put your chin right there. See, I'm not really going to push him forward or change the position of his head. I'm following exactly where his body wants it to be. So I'm going to go ahead and bring him to the middle and then smile big for me, making sure that the line is in the middle. That's super important. And that basically captures all the anatomical structures that I need to have. So I'm going to go ahead and that's perfect. So this is a perfect positioning for a full field of view. Last video I showed the patient positioning for taking the CBCT. I just want to give a few instructions on the cueing a patient while you're taking the x-ray. Obviously, you want them to make sure that they're still, they're not moving their head, and they're keeping and holding onto the handles. And also, don't tell them where to put their tongue, nor do you want to instruct them on how to breathe. So you just have them put their teeth together, swallow twice, and hold still.